Did you take up anesthesia by choice or by chance?
The trainee young anesthesiologist should accept the responsibility of being a perioperative physician.
But among the general public, there are so many myths involving anesthesia. Hello everyone and welcome to this special episode on World Anesthesia Day. I am Dr. Soumya Joyce. Today, October 16th, marks an important milestone in the history of anesthesiology. Today was the day when the first public demonstration of ether anesthesia was done by W.T.G. Morton. This landmark event transformed the way surgical practice was done, from being terrifyingly painful to safer and scientific practice. To give more insights on the importance of anesthesiologists, we have Dr. Karthik GS, Professor and Head of the Department, Rajarajeshwari Medical College, Bangalore, affiliated to MGR Educational and Research Institute. I welcome you, sir.
Thank you, madam. It's my privilege to be here.
Sir, anesthesiology has advanced by leaps and bounds in the past century. What do you think is the greatest innovation in the field of anesthesiology?
In recent times, we see a lot of technological innovations in the field of anesthesia. But still, what I feel is the most rewarding and landmark innovation in the field of anesthesia is the invention of pulse oximeter, because it gives us instant and real-time monitoring of the patient's hemodynamic status, including heart rate, and also it gives us an important information about the oxygen saturation of the patients. You would have seen this in the COVID era.
Yes, sir, no doubt. Though simple, it has helped save many lives during COVID.
Definitely, ma'am.
Sir, it is so fascinating to know about the journey of anesthesiology right from the day of ether anesthesia. I just wanted to know how your journey was. Did you take up anesthesia by choice or by chance? Because some of us end up in anesthesiology by chance.
Indeed, it's a very interesting question to answer. I'm happy to say it was absolutely by choice. It was not by chance. Because during my MBBS time, when I used to enter the OT, I used to see two people. One was the surgeon who was focusing on the surgery, and the other doctor was an anesthesiologist. He was focusing on maintaining vitals and stability in the patient who was undergoing surgery. So that is why I felt this as very interesting. This, along with the blend of critical care, made me to choose this wonderful branch.
Sir, it is so fascinating and wonderful to follow the path where you are passionate about. And as professionals, we are enjoying how the anesthesia is advancing. But among the general public, there are so many myths involving anesthesia. We often hear terms like overdose, death, backache after spinal anesthesia. How do you think we should address all these problems?
It's a very important question, madam. To clear the myths among both the patients and the general population regarding anesthesia and its complications. As such, there is no word regarding anesthesia and complications. Definitely it's a myth, or you can say it is a misconception. Every anesthetic technique is tailored based on the patient's age, weight, medical conditions, and the type of surgery. So we accordingly give the proper anesthesia. In the sense, what I mean to say is everything is tailored, or it is customized to each of the patient. And nowadays, all the operation theaters have newer modalities, technologically newer modalities. So there is no chance of error or something. So what I still feel is we need to create an awareness among the public that we are the perioperative physicians. We are striving hard to keep them alive in the operation theater. This is the message we need to define, or we need to give to the general public as well as the patients who are undergoing surgery.
So patient education is very important to have a calm patient. And with every calm patient, there is an anesthesiologist who is tirelessly working, considering all the comorbidities, critical situations. I just want to know, in your experience, what was the most challenging case and how rewarding it was?
Madam, I still remember as the head of the department, we anesthetized a young patient who had come for some complex intra-abdominal surgery with the compromised cardiovascular status. It was a good teamwork. All of us were involved. My whole team was involved in that. So intra-op, this patient had a cardiac arrest. We successfully resuscitated this patient with all our expertise. And after 4 days, when we visited the patient in the ICU, the patient was sitting and talking to his relatives. So this gave us an immense satisfaction that we could salvage a young breadwinner of a family. What we want more than that, madam?
We are actually happy being silent warriors and being behind the screen. Sir, with the revolution of AI in all fields of medicine, do you think artificial intelligence could replace anesthesiologists?
Madam, basically, anesthesia is the combination of both science and judgment. The science part is well taken care by the AI because it will process the data relevant to the patient and their monitoring modalities. But when coming to judgment, definitely I feel coding human intuitions, experience, and leadership is very difficult into an AI, especially during crisis. So my personal opinion is AI is definitely a supplement to an anesthesiologist. I don't think so it can act as a substitute.
We can actually adapt using AI. We can generate models and equipment, and then advance with the advancing technology.
AI is definitely a rewarding thing. I don't say no, but as I said, judgment wise,
Yes, sir.
humans are the best. Even when considering the ethical issues and crisis management, I think human anesthesiologist is the best and he is irreplaceable.
So, technology aside, what about nurturing next generation? What advice would you like to give to young doctors who are willing to take up anesthesiology as their career?
Madam, anesthesiology is a fantastic, challenging, and a dynamic branch. I encourage all the post MBBS students, youngsters, to take up this specialty as their career. Because nowadays, anesthesia is not just confined to four walls in the OT. It has got lot of ramifications. They can specialize in pain medicine, they can specialize in ICU, they can choose their career as transplant, cardiac, or neurological or neuroanesthetist, and definitely it has ramifications. And they have an opportunity to exhibit their skills in pain management, insertion of lines, regional techniques, and so on. So I still feel the youngsters should take up this career.
Indeed, sir, it is quite rewarding to take up anesthesiology. Though we are behind the screens nowadays, as you said, we can practice pain, we can sit in OPD, and branch out into various types of anesthesia practices.
As you say, it's a myth, madam, that people consider as they consider as doctors behind the scene. But definitely, we are the frontline warriors. As you saw,
Exactly.
we were the people who led the battle against COVID, mainly. And so it's a privilege to become an anesthesiologist. We should never think that we are behind the scene. And there's a quote which tells that surgeons are captains of sailing ship, whereas anesthesiologists are captains of sinking ship.
True, sir, well said. Sir, on the occasion of World Anesthesia Day, what advice would you like to give to young trainee anesthesiologists?
The trainee young anesthesiologist should accept the responsibility of being a perioperative physician. So they are considered as guardians of consciousness, masters of pain management, and protectors of life, according to me. So they should be immensely proud to take this specialty, and they should give their 100% in the perioperative management of all these patients. So I definitely encourage all trainee anesthesiologists to adopt all these characters in their curriculum and do well to all the patients, especially in the perioperative period.
Yes, sir. Sir, thank you for all your insights, experiences in the field of anesthesiology.
Thank you, madam. I once again congratulate all the members in our anesthesia family for having given their services all these years. Still, we are continuing to be a part of the perioperative management in all the patients, especially in all the fields. Once again, I wish all the anesthesia fraternity a happy World Anesthesia Day, October 16th. Thank you.
Thank you, sir. On this World Anesthesia Day, let's celebrate the progress of the field of anesthesiology right from the day of ether anesthesia to today's modern innovations and technologies. It is important to honor all the anesthesiologists who are working tirelessly, being silent guardians, and yet keeping the patient safe, calm, and comfortable. Thank you.